Good morning, good afternoon, good evening to you all. Thank you for joining this webinar convened by Philips Foundation. This webinar will discuss how we together can transform healthcare through digital and intelligent technologies while unlocking better care, especially for communities where it is currently lacking. Philips Foundation and our impact investments have the aim of providing access to quality healthcare to underserved communities by deploying Philips expertise in healthcare technology and exploring innovative as well as sustainable healthcare delivery models. Next slide, please. We believe that innovation and collaboration can help solve the challenges to provide healthcare for the underserved and make essential impact. By deploying technologies that can unlock quality healthcare for people that have no access to it, by strengthening community and primary healthcare, by seeking or building financially sustainable solutions independent on continued donations. Philips Foundation deploys and looks for technologies that can enhance efficiency in healthcare, that can improve patient outcomes, address lack of financial means and lack of human resources. All solutions we propose must take these challenges into account. This webinar is to promote learning and the diffusion of knowledge on using the power of digital technology and AI to enhance equitable health and well-being. The speakers of today range from leaders of ventures we invest in, our project partners, as well as Philips research and innovative technologies within the Philips Group. We hope these webinars lead to further collaborations and improvements in achieving inclusive healthcare and well-being. I will now hand over to our colleague, Beatrice Murage, who will lead us through this webinar. Over to you, Beatrice.
Thank you, Margot. Welcome everyone to today's webinar. We are thrilled to have you join us. I am Dr. Beatrice Murage, Global Senior Manager Access to Care at Philips Group Sustainability, and I will be moderating today's session. Last year, the World Health Organization published a report tracking the status of universal health coverage globally. In this report, about half the world's population is not covered by essential health services. We're talking about 4.5 billion people. As you see on this slide, most underserved areas are in Asia, Africa, and South America. However, disparities in access also exist in areas with predominantly green regions on the map, like North America and Europe. In recent years, integration of digital technologies and artificial intelligence in the delivery of care has demonstrated the potential to improve access to care, enhance efficiency, improve patient outcomes, and transform how care is delivered for underserved communities and served ones too. In today's webinar, we aim to share learnings on innovative digital solutions that integrate artificial intelligence to improve access to care, especially in underserved communities. We have a wonderful panel of speakers to help us do that today. For the first panel session, we'll have two speakers. The first one is Dr. Craig Sable, Interim Chief of Cardiology at Children's National Hospital and Professor of Pediatrics at George Washington University School of Medicine. Dr. Sable is recognized as an international leader in pediatric echocardiography, telemedicine, and global cardiovascular disease. Today, Dr. Craig will discuss the use of AI in expanding access to rheumatic heart disease screening. The second speaker will be Dr. Pallavi Vajinapalli, Principal Scientist and Group Leader in Ultrasound at Philips. Dr. Pallavi drives research innovation that has led to first-of-kind prototypes, new features for product, and generation of intellectual property. Dr. Pallavi will highlight how AI is expanding access to obstetric ultrasound. The second panel will have three speakers. The first one will be Moaz Hossam, Chief Business Officer at Rology. Moaz is the co-founder and Chief Business Officer of Rology, where he leads the company's expansion efforts across Middle East and Africa. Moaz today will highlight the use of teleradiology and AI-enabled technology to expand medical imaging in underserved settings. We also have Delphine Germain, Senior Product Marketing Manager at Philips Cardiologs. Delphine combines a wealth of experience in medical imaging and AI cardiology solutions with a passion for using cutting-edge technologies to revolutionize patient care. We have Linda Koenig, Operations Manager, Philips Health Technology Innovation in Paris, also joining us today. And Delphine and Linda will highlight solutions expanding cardiac care through AI-enabled technology. Before we get into it, a quick reminder to please post your questions in the chat throughout the webinar today. We will address those questions during our Q&A session later in the webinar. Now, let's get into it. First up is Dr. Craig. Dr. Craig, welcome.
Thank you so much. It's an honor to be part of this esteemed panel. And I just want to acknowledge the Philips Foundation for being a transformative partner in what has been for me a 20-year global health journey, much of which has been focused on rheumatic heart disease, a disease that some of you may not know much about. In 2024, more than 45 million people are living with rheumatic heart disease, with nearly 400,000 fatalities each year. As shown on this map, the most impoverished regions on Earth with the fewest doctors are highly endemic for rheumatic heart disease, with sub-Saharan Africa being the worst off. Rheumatic heart disease is the long-term sequelae of the body's reaction to strep throat. The immune system, in its attempt to fight strep throat, attacks the heart. And in areas where there's poverty and limited availability for diagnosis, it is still endemic, and the impact is very similar to HIV, TB, and malaria, yet the funding is less than 1/billionth of those other diseases. We know that late detection drives poor outcome. The graph in the middle shows a study from our Ugandan registry. There was about 3,000 patients with clinical disease, severe disease in Uganda, and of those, about 600 are children. 75 were fortunate enough to get surgery with nearly 100% survival. However, those who don't get surgery and present late, the 5-year survival is less than 60%, with the mean time from diagnosis to death of under 1 year. Clearly, we have to do better, and providing massive surgical programs for the millions of patients that need it is not the answer. But this disease is completely preventable if we can find it in the earliest stages. And the majority of the 45 million are in these early stages where the disease is mild. Probably 2 to 3 out of 100 children in endemic regions show the signs of early disease. But we know that echo screening has the potential to find kids early, put them on penicillin, which can prevent the progression to needing surgery, and completely change the face of this disease at the cost of pennies per children. Next, please. For the last several years, we've been embarking on multiple ultrasound-based projects to try to find the prevalence of rheumatic heart disease. This slide focuses on the GOAL trial. The critical question we needed to answer was whether or not early rheumatic heart disease could be prevented by giving penicillin. And what we did was we enrolled about 1,000 children. Half got penicillin and half didn't. And the way we found those 1,000 children was by partnering with the Philips Foundation in screening over 100,000 children in Uganda using the Lumify over about 5 months. And through that screening, we were able to enroll patients in the trial. The trial, which was published in New England Journal of Medicine in 2021 and led by my colleagues, Drs. Andrea Beaton in Cincinnati and Emmy Okello in Uganda, showed unequivocally that preventive antibiotic treatment resulted in reduced risk for children living with asymptomatic rheumatic heart disease. Less than 1% of those who got penicillin prophylaxis progressed, whereas 8% of the control population progressed. This is highly significant, with a number needed to treat of only 13 to prevent progression of rheumatic heart disease. Next, please. So we know that rheumatic heart disease can be prevented if we use ultrasound and find it early. So we now have critical questions that we're facing. Number one, how can we integrate with primary healthcare services to scale active rheumatic heart disease finding? And We're currently working with an NIH-funded project that the Philips Foundation has supported to move from a study setting and research to a clinical setting where we're focused on 36 healthcare centers in rural northern Uganda, deploying Lumifys, using a telehealth solution, training nurses who already work in these clinics. And to date, we've done nearly 10,000 echo screens and have made significant progress in scaling rheumatic heart disease. Secondly, the promise of automated intelligence for view finding and diagnosis is just now being realized, and I'll talk about that more in a second. And finally, we need to do cost modeling for national healthcare programs. We need to figure out how we can make a case for investment. We know that what we should do is include rheumatic heart disease control in programs in national health systems on the same par as HIV, TB, and malaria, but we need to make the case. The promise of artificial intelligence has only recently been realized. The image on the top right shows what we call color guidance, the idea that you can train a novice for a few hours, and then artificial intelligence will help them find diagnostic quality images. Even more exciting is diagnosis, the ability for us to use artificial intelligence to analyze an image and within seconds tell us whether a patient is screen positive or screen negative for rheumatic heart disease. And our preliminary work has shown that AI guidance enables novices to obtain images that are of diagnostic quality 91% of the time. And we recently published a paper showing that we can get up to 86% accuracy with diagnosis. And we were really fortunate that that work was just published on the front page of the Washington Post. And it's really helped bring others into our field to focus on artificial intelligence. So the combination of artificial intelligence, telemedicine, handheld echo like the Lumify, and task shifting can be a game changer to democratize ultrasound and help eradicate rheumatic heart disease in our lifetime. And I want to conclude with a short video that demonstrates the power of artificial intelligence.
We're working on several fronts to use novel technology to make this even more sustainable and scalable. We're using artificial intelligence to help allow someone with limited experience to get the best pictures possible. When you put the probe on the chest, it will tell you to move left or right to get the ideal picture. And when you get the ideal picture, whether you recognize it or not, it'll automatically acquire it. Even more importantly, we've developed technology that can tell you whether or not the patient has rheumatic heart disease. Within a couple minutes, the artificial intelligence technology can analyze the image and say it's screen positive or screen negative. It completely changes the equation for scalability. We can scale this throughout endemic regions, potentially impacting hundreds of thousands of lives. This will have a huge impact by allowing novices to determine whether the patients they're screening have rheumatic heart disease on the spot.
Amazing, amazing, amazing. I love one thing about this section, and that is just the ability, or rather the potential that digital technology provides for scaling, and not just piloting or small scale things. Thank you, Dr. Craig. We move to the next presenter, Dr. Pallavi, and she will tell us more about a use case in obstetrics. Dr. Pallavi, welcome.
Hey, thank you so much, Beatrice. Hello, everyone. Today I will be talking about one of the ultrasound-based AI solution that we are developing in Philips to improve the antenatal care for low and middle income countries, especially focused on the primary care. So as many of you would know that WHO has recommended that every pregnant woman should undergo at least one antenatal scan before 24 weeks of gestation. Unfortunately, this is not a reality in many of the low and middle income countries. For example, in say in rural India or a rural Kenya. This is because of the shortage of sonographers who can do an ultrasound scan. limited access to the ultrasound device itself, and most importantly, inadequately trained healthcare professionals in using an ultrasound system because of the complexities that an ultrasound scan has in it. All these together makes it difficult for the healthcare professionals who are catering to the antenatal care in these settings to actually distinguish a risk pregnancy from a normal pregnancy. And hence, we at Philips would like to support these healthcare professionals in low and middle income countries to confidently operate a basic ultrasound device so that they are able to enhance the quality of care by identifying risk pregnancies very early during the pregnancy journey itself. Next slide, please. So Philips has collaborated with Bill and Melinda Gates Foundation to develop an AI-based solution on Philips handheld ultrasound device called Lumify, which can automatically detect 6 clinical parameters. Can we have go to the next slide, please? Which can automatically detect 6 clinical parameters that are essential in the obstetric screening, which includes the gestational age, the presentation of the fetus, what is the location of the placenta, how much is the amniotic fluid, is it sufficient or not, multiple gestation, whether it is a single pregnancy or a twin pregnancy or so on, and most importantly, the cardiac activity, what is the health of the fetal heart. So these are the 6 parameters that in this solution we are trying to automatically provide to a healthcare professional using a very simple acquisition protocol, as you can see in the left images, where the user, or here a healthcare professional, is supposed to do a scan which includes 3 horizontal sweeps and 3 vertical sweeps, and that's it, nothing more. And our AI algorithms are actually going to provide these 6 basic measurements that are required to screen any kind of pregnancy. Can we move to the next slide, please? As a part of this program, we collaborated with Aga Khan University and Kilifi County Ministry of Health in Kenya to conduct a pilot test in couple of clinical sites in Kenya, especially in the Kilifi County. And in this particular pilot, we actually enrolled almost 60 pregnant women and 6 nurse midwives who were not trained in using an ultrasound system. So these 6 nurse midwives were provided our prototype, and they were given a very basic training on how to use the prototype. And this prototype was then used by these midwives on the pregnant woman using the scan protocol that I just mentioned, just 3 sweeps horizontally and 3 sweeps vertically, and which provided the clinical parameters. And these clinical results were from our prototype were actually validated by the validated with an ultrasound scan, which is normally done, or a standard ultrasound scan, which is done in the pregnancy. The pilot results were very encouraging. It showed that typically what an ultrasound training is needed for midwives, which goes to around weeks and months, that got reduced to just a couple of hours. And most importantly, this also gave a confidence to the nurse midwives in performing an antenatal care. And what was really interesting here was the fact that none of these midwives have actually used an ultrasound in the past. They have never used an ultrasound in the past, and with this very simple approach of blind sweeps, and with AI in the background, these midwives were able to know immediately the 6 clinical parameters that is very essential for the obstetrics care and to identify risk pregnancy for any kind of reference. So I would like to conclude here by saying that the prototype or the solution that Philips is developing, and this pilot showed that we can actually, with this kind of simple approach, we should be able to improve the antenatal care and in fact reduce the maternal mortality and fetal mortality morbidity together. Hey, thank you so much. I'm open to any questions.
Thank you so much, Pallavi.
Over to you, Beatrice.
Thank you, Pallavi. I love the two aspects that you've seen in the previous session and also this one in terms of bringing a co-creation attitude together with the healthcare provider. So we're not creating solutions apart from them, but together with them, and that it's actually in the settings for which we hope to create impact. So that was very encouraging to hear from Dr. Pallavi and also from Dr. Craig for two different use cases: cardiac in pediatrics and obstetrics also in adult women. Moving on to the next panel, we have our next three speakers, and they'll be looking more at a platform approach, a bit more of the teleradiology pieces, a bit more of the analytics and data aspects. And to start us with this particular session is Moaz. Over to you.
Thank you. Thank you, Beatrice. Well, let's dive into a pressing issue that is facing global healthcare today. That is the significant shortage of radiologists. This is a challenge that affects real lives, leading to delays in medical imaging interpretation, and such delays are particularly harmful in specialized cases. Now imagine the anxiety of waiting weeks for a diagnostic report that is crucial to your treatment plan. Unfortunately, this is the reality for many, and it directly compromises the standard of care, especially where specialized expertise is scarce. The situation is compounded as radiologists, stretched to their limits, are forced to cover multiple facilities and subspecialties. And to grasp the scale of this challenge, especially in Africa, let's consider some of the statistics. In Kenya, there is only one radiologist available for every 415,000 citizens. And in Ghana and Nigeria, the ratio approximates one radiologist for 800,000 citizens. Ethiopia faces an even grimmer reality, with only one radiologist serving up to 1 million citizens. Now, these numbers underscore a significant bottleneck in healthcare delivery, where the scarcity of radiologists severely delays diagnostic reporting and treatment initiation. And the promise of technology to bridge healthcare gaps is yet to be realized in lower resource settings. Existing digital tools often fail to meet the needs due to infrastructure gaps, complexity, or cost. And far from mitigating the radiologist shortage, this technology gap exacerbates the healthcare disparities, and they leave vulnerable populations at greater risk. And this highlights an urgent need for a scalable, accessible, and cost-effective digital health solutions that are tailored to the unique needs of lower resource environments. Next slide, please. Thank you. Now let me introduce you to Urology. Urology is a groundbreaking solution that has been crafted to tackle the global shortage of radiologists with a focus on lower resource environments. Urology is an AI-assisted teleradiology platform that seamlessly connects medical images with radiologists based on the availability and subspeciality of the radiologist. Now, this enables instant and remote interpretation of medical images coming from hospitals across the globe, ensuring timely care without geographic or resource barriers. The technology is engineered from the ground up to excel in environments with minimal technical infrastructure. Urology operates seamlessly on low-specs computers and under unstable internet conditions. A centralized engineering team can support the deployment and provide ongoing remote support, enabling local personnel to easily implement our system. Deployment is swift and remote and often completed in less than 30 minutes without needing specialized technical know-how. And our commitment to vendor neutrality allows Rology to integrate with any radiology equipment, eliminating barriers to entry and fostering a more inclusive healthcare ecosystem. Now, this design philosophy ensures that Rology is a versatile and accessible option for healthcare facilities worldwide, and especially for those in underserved regions. Metrology innovation extends beyond technology delivery to care delivery as well. We have developed a network of over 100 radiologists that, utilizing our platform, we can match them with medical images based on their availability and subspecialty. And our suite of AI-enhanced tools support those radiologists and increases diagnostic accuracy and efficiency. Now, the AI tools include tools that can triage a radiologist's work order, ensure if medical images deemed abnormal by our AI algorithm get top priority in reporting, and it also extends to support in the reporting process itself, where our AI tools can guide the radiologist to the region of interest in the medical image and provide AI-powered tools that can cut down the interpretation time significantly. The AI boosts the radiologist's productivity and enables them to assist more patients in need. Now, this comprehensive approach allows Rology to provide rapid, accurate diagnostic reporting to medical facilities at a cost-effective price point, significantly impacting patient care in lower resource settings. The platform transcends the traditional barriers and it democratizes access to quality radiological services. And this allows radiologists to deliver fast, accurate diagnostic reporting at an affordable cost, transforming patient care in lower resource settings in the process. And importantly, all of these advancements are achieved without compromising on excellence or on safety. I'm very happy to share that all of Rology's technology is FDA cleared, reaffirming our commitment to reliability and high standard care. Next slide, please. Thank you. So, lessons we have learned during our journey in Rology is, we embarked with a philosophy that AI, when guided by human expertise, can significantly enhance healthcare delivery. Our experience has reinforced the belief that AI should not be seen as a replacement for human expertise, but as a powerful tool to augment and amplify the capabilities of healthcare professionals. This approach has allowed us to deliver tangible value to the communities we serve. A pivotal aspect of our success lies in our commitment to localizing AI solutions, and this means developing and implementing AI tools that are specifically designed to meet the unique needs of the populations and healthcare facilities we work with. And by focusing on specific problems and challenges faced by these communities, we have been able to make a real difference on the quality of healthcare delivery. Our achievement speaks volume about the impact of our approach. We have an installation base that has grown to 200 hospitals, and we have delivered diagnostic reporting to over 800,000 patients across Africa. As this represents countless lives that are impacted, diagnosis clarified, and treatment initiated more swiftly. It is a testament to the power of digital technologies and AI in providing access to healthcare. And looking ahead, we are on track to reach a monumental milestone in 2024 by providing diagnostic services to over 1 million lives. The goal is within reach, thanks to the dedication of our team and the trust of our partner hospitals and partners like Philips Foundation, and also thanks to the robustness of our AI-assisted technology. And as we move forward, our focus remains on innovating and refining our solution to continue to break down barriers to healthcare access and to improve patient outcome in lower resource settings and beyond. We believe our journey with Rology demonstrates that when technology and human expertise converge, the potential to transform healthcare is limitless. Thank you very much. Back to you, Beatrice.
Thank you so much, Moaz. I love that there's a bit of a shift in the focus for this panel and what Rology is enabling clinicians to do in a setting where you have very few clinicians for the general population, and just being able to strengthen that collaboration and bringing the doctor closer to the patient, or at least the doctor's expertise closer to the patient, all driven by technology. That's amazing to hear. Thank you. I'd like to invite Delphine and Linda up next. They'll be telling us a bit more about the power of the platform as well, and also cloud technology to democratize access to cardiac care. Delphine, Linda, welcome.
Thank you, Beatrice, and very happy to participate to this presentation. Next slide, please. So we've talked a lot about imaging. We'd like now to introduce you to another application for AI technology, which is the analysis of ECG data. And first of all, to tell you a bit more why ECG is an important diagnosis test, I'd like to remind you this is the most common cardiovascular diagnosis test being performed globally. It's also widely accessible and cheap, and it can be used, of course, in the hospital where it's performed with bedside monitorings, but also outside of the hospital where it can be used in practice offices with cardiographs. It can be used in emergency departments as well, and it can be used, of course, for patients at home with ambulatory ECG monitoring and specifically Holter monitoring that can record ECG data for days to detect infrequent pathologies. And last but not least, it's getting now available on smartwatches where, ECG is getting available. It's a very powerful diagnostic test, which can detect up to 100 different abnormalities just with a recording of about 10 seconds. So very powerful test. But one of the issue, and this is a paradox about ECG, is that it's a highly complex signal to interpret. And some metadata have highlighted that the accuracy of ECG assessment performed by practicing physician is as low as 68%. One of the reasons being that it requires deep cardiology expertise, and there is, of course, a shortage of this expertise globally. So that's why we thought that there is a huge opportunity for AI technology and cloud as well to be developed to leverage really all the capability of ECG to democratize access to expert cardiac care. Next slide, please. How does it translate into a real-life case study? So this is, a situation that we've been facing where there was a stroke rehabilitation center that was requiring to screen patients for atrial fibrillation, one of the most frequent arrhythmia that is present and is causing, stroke. It's one of the main drivers for this type of events. And the problem, of course, is that in stroke rehabilitation centers, there is no cardiology expertise. So what happened for these patients that need to be screened to avoid secondary events to happen, secondary stroke events, they had to be transferred to a cardiac center by ambulance to be hooked up with a Holter device, bring back to the stroke rehabilitation for the recording to happen for several days. And then at the end of the recording, the device had to be shipped back to the cardiology center where the clinical team there had to look at the recording, produce a report that again had to be shipped back to the stroke rehabilitation center for treatment to be managed. This is, of course, a very complex workflow, and it was raising a lot of, issues for the staff to organize all this logistics. But also, really, what was a big problem is that the time to diagnose this patient was about weeks or months due to the waiting list as well and the complexity of the workflow. Next, please. So what we have done while implementing the Cardiologs solution is that we have completely eliminated all these different requirements for patient transportation and logistics of devices by implementing a solution that is available in the cloud, which allows the patient hookup and recording to be entirely managed in the stroke rehabilitation center, and the data are available instantaneously for the cardiac center as soon as the recording is uploaded into the cloud. On the cardiac expert center side, they can benefit from our AI to perform the analysis and the interpretation in a much faster way and a much reliable way. And as soon as the report is finalized, this is immediately available for the stroke center to be able to take care of the patient accordingly. This translated in a time to diagnose that is only of 2 days now, And this is really some results that we have seen not only in this case that is illustrated in this page, but also for many different healthcare network organizations where some remote centers do not have access to cardiology expertise and need to have these exams being performed locally on their patients while still benefiting from the expertise of cardiologists that are located in cardiac expert centers. So that's very, very good, illustration. Next page. And just to give you a bit more of background about our solution, so you've seen how cloud-based technology can support the simplification of the workflow, but there are two other pillars of our solution that are also supporting a lot the improvement of ECG interpretation, and one of them is really the AI algorithms that we've been using. This is using deep learning capabilities, deep learning algorithms that help tremendously to reduce the amount of false positives, as well as increase the sensitivity for key arrhythmias such as ventricular tachycardia. And then, of course, it supports cardiologists to reduce the analysis time that they spend interpreting this examination by about 42%, making best use then of their time to address more complex cases and concentrate on the patients. Also, one important element is vendor neutrality, and we have been able to offer this service to recordings that are performed in different type of devices, making it more widely available. With that, I'd like to hand it over to Linda, my colleague, who will manage the next pages. Next page.
Yes, hello. So how and where are we making it all happen? Cardiologs is a French company that was acquired by Philips in 2022 and has been integrated as a whole, meaning we have kept the Cardiologs team and ways of working. We have kept the entrepreneurial spirit, the product development, data science expertise, and the agility that comes with a SaaS product, while leveraging the Philips brand and commercial network to increase the reach of our solution. We are part of a new Philips innovation site located in downtown Paris in the center of the tech district, which allows us to set up a dynamic of innovation, transfer of skills, and cross-fertilization of projects between teams. Win-win, install a startup spirit and velocity within the Philips structure. The Cardiologs platform has been developed together with data experts and medical experts, but also with our clients that use our solution. So this is what they say about the clinical adoption. I hand it back to Delphine, and the next slide, please.
Yeah, very proud to share, these quotes from our customers. First of all, Marisa Lowe, who is part of one of our partners organization operating in South Africa. And Marisa has been, and the team of Virtis has been leveraging Cardiologs to offer Holter ECG analysis services, helping to diagnose more patients faster in this region of the world. And on the right-hand side, you see as well a testimonial from Fiorella Salermo, who is using our technology to provide access to their expertise, their cardiology expertise in a hub and spoke type of network, and offer these services not only to their own patients, but also to patients that are located in surrounding facilities, stroke centers, and also geriatric clinics that are located in their region. Thank you for your attention, and let's move to the concluding discussion.
Thank you so much, Delphine and Linda. Quite interesting to see what Cardiologs can do. And I love the fact that it's looking at a global landscape for both underserved and even served settings as well. So it's really good to see how that's coming together. Thank you, everyone who's joining us today. I see we have over 200 people logged in today and listening in, and also sharing some questions as well. Please keep sharing your questions in the chat. We'll address as many of them as possible during our next Q&A session. And if not possible, we'll still be able to interact with you even after the webinar is over. Calling back all my speakers back on the spot so that we can look at a couple of things in terms of questions and also comments that have been raised. I'll start with you, Dr. Craig. Question. As a cardiologist, how do you see artificial intelligence changing the diagnosis and treatment of heart disease, especially for underserved communities? And if I might add to that, that interesting intersection between pediatric care and even care for adults, and also that intersection between, let's say, medical technology and also the drug technology around it, like you're doing for the study with heart healers. Over to you, Dr. Craig.
Thanks so much for the question. And I think we're just beginning to understand the potential of artificial intelligence to transform early diagnosis in low-income countries for diseases that are highly endemic. And for me, we've proven in the research realm that we can do some of this. So I think the huge potential for artificial intelligence is scaling and changing the cost equation, really tipping the needle. From something that, although we know we should do, is too expensive, it's not practical, to making it something that can be integrated within the public health system. And the whole idea of making AI the answer to the question, how do we democratize ultrasound? We all know as experts that, and I've trained for years to be able to do something that now I'm asking a novice who's busy doing many other things in the primary healthcare center to pick up a Philips Lumify and in 1 or 2 minutes help to add to a screening test that can save a life or save millions of lives. And I think it gives me perhaps the ammunition to go to ministers of health and to global policymakers and funders like the Gates Foundation to say, you know what, we can truly take this tool now that when I first started training was a several $100, several hundred kilogram, several $100,000, several 100 kilogram piece of equipment to now deploy it in the primary healthcare setting.
Okay, amazing. Dr. Pallavi, there are concerns of AI replacing the human interactions in healthcare or replacing the work of specialist health workers with non-specialist healthcare workers. Are these concerns valid? And how do we ensure successful implementation of AI solutions in healthcare?
Hey, Patrice, it is generally believed that AI tools will actually replace the work of experts and or the healthcare professionals. AI is not here to replace the work, but actually to enhance and facilitate the human work, facilitate these and support these experts. But for sure, a doctor who is not using AI will be replaced by a doctor who is, a doctor who is not using an AI will be replaced by a doctor who is using AI. AI is going to be part of the healthcare, and as we all see with different kind of tools and solutions that we saw today, AI was actually enhancing the care. It was improvising the care. So that's my take on your first question. And coming to the second question, AI in healthcare relies extremely on the data, how good the data is. It is very important to ensure the quality of the data is very good. It involves a lot of curation of the data, cleaning of the data, pre-processing data, and remove any kind of inconsistency that is there in the data. And most importantly, the data should also meet the regulatory requirements. That is actually very important to have a good AI solution in healthcare.
Okay, thank you, Dr. Pallavi. Moaz, question for you. What is the future of AI in radiology, and what do you see as the main challenge and opportunity area in that sense?
I think the future for AI in radiology, actually, there's a lot of potential. AI can enhance the diagnostic accuracy, eliminating a lot of the mistakes that may occur due to human error. It can improve the workflow efficiency in the radiology department and for the radiologist as well. It can assess a personalized treatment plans. This might be perhaps the biggest promise we can see, where we'll be able to personalize treatment plans for each specific patient based on their own medical history. Challenges, well, I think we have a challenge of making sure the technology be robust, that it can be able to handle the patients coming in from different regions, different ethnic background, and so on. We also have a challenge about how we can ethically integrate AI into our workflow and how we can make sure that when we are developing new technology, we're not amplifying some biases that already exist in the data that we are using for training. That is very important, so that we make sure that what we're developing is actually usable and of equal value to everyone else. And opportunities, well, I think it will start perhaps the same way most all technology, by handling more routine tasks that a radiologist or someone on a radiographer or so on would be handling, and then it would be moving on to more complex cases. As we have more and more access to data, more advanced algorithms, we might even see the case, though it might be a bit in the distant future, when we might start to detect diseases and pathologies in a way is different than we used to be able to do, or modalities that were not previously used for such scans. And of course, we have a challenge that lies in how do we regulate all of this and make sure we're mitigating the risks of this new technology.
Okay.
I believe that's, that's all.
Got it. Delphine, what are some of the ethical considerations involved in the use of AI in healthcare?
Yeah, no, that's a very good question. I think there are several aspects to it. One is about transparency. And the other one is about algorithm bias. So regarding transparency, I think what we want to do, and we are doing right now when we contract with our clients, is that we are very transparent about how we use their data, where they are processed, where they are hosted. If we are using some of them for research, which part of this data we are using, being clear that we only use anonymized data for research. This type of elements are important to describe. So really we are fully transparent. And when we sign data privacy agreement with our clients, they know exactly what it means. And there is then transparency on what we do.
Okay.
The second aspect maybe is about potential bias that can be included into algorithms. And that's one of the debates today also about development of AI algorithms, where we need to make sure, of course, that the algorithms that are being developed are going to be valid for all subpopulations. And that's why, being available in the 5 continents, we are able to get data, that come from these different geographies and use them to train our algorithm. We are also very careful to include, data set from patients of different genders, of different age range, so we really develop algorithms that would work in different subpopulations.
Okay, clear. Dr. Stable, there's a question from the audience on, is there a need to also prevent over reliance or too much trust on AI here? And an example that was highlighted to avoid is one of avoiding false positives. What do you think, Dr. Craig?
I think that's a really critical question, and it's important as we're developing our diagnostic algorithms to balance sensitivity and specificity and consider the context in which we're using the AI. Specifically for rheumatic heart disease screening, we think of this as a 2-tiered system. So we are going to skew our algorithms to favor sensitivity at the expense of having false positives, but doing it within the healthcare system where we would train regional health providers to do second-tier testing so we optimize the balance. I think it's challenging to solely rely on AI diagnosis without having either sacrificing sensitivity or specificity. So I think a tiered approach, at least for now, is something that if we use the AI tool to at least screen out 90 to 95% of those that don't need a level 2 screen, then we believe we may have the right compromise.
Okay. Dr. Pallavi, there's a question regarding primary barriers, and have you noticed any during your interaction? That is the barriers that would be preventing underprivileged or rather underserved community members from accessing healthcare services, and how are you helping break those barriers through AI?
Yeah, I think one of the most important thing that I've noticed is the unavailability of experts in these kind of settings, which cater to the underprivileged community, right? So what becomes very important is how can we support task shifting for the current healthcare professionals who are present in these settings. And the best approach here is to empower the current healthcare professionals who may not be who may not have the expertise that an expert in other care settings would be having, but by providing support, by providing the AI tools like what we just showed you in the presentations today, can actually empower these healthcare professionals to do much more than what they are doing at this point of time.
Okay. I think just as we're wrapping up this session, one more for Moaz as well. And there's a question around, will the advent of Rology AI and or combined with Lumify, for example, eliminate the need for angiograms for patients? So how do you view that?
Well, specifically for angiogram, I would say that's a question perhaps in need of someone who's more medical expertise than me. But I would say that in general, AI could take us in a direction where we might be able to get more information, more output from scans that we did not get before. So whether we'll be able to eliminate a set routine of scans or not, I think it's a bit too early to be able to tell that.
Okay. And Delphine, what obstacles would GDPR regulations bring to teleradiology, and how does that impact your work?
In fact, the GDPR regulation is something that we are, of course, dealing with today as part of our ECG activity, not that much radiology, but with ECG interpretation. And really, one of the main aspects is to make sure that when we implement a cloud technology, we are also compliant with the data privacy elements of GDPR. And today, it is true that this regulation is a bit more strict compared to what it is in other regions of the world. But we have been able really to demonstrate that the way we implement our cloud technology and our AI is compliant with some requirements that are part of our GPD. So I see that being one of the elements that we need to demonstrate to hospitals when we contractualize with them. But I don't see that as really stopping our ability to implement our solutions.
Okay, thanks. Moaz, there's a lot of interest on the Rology. There's one really loaded question, so I'll unpack it slowly. Maybe you can give us some feedback. So, has Rology worked in rural Africa? There are challenges with electricity, power in the primary care level facilities. And in addition to that, the clinicians are not always able to access the internet, either due to workload or technical and infrastructural challenges. How is Rology navigating that, if at all? That's question number one. Number two, in what format is a diagnostic report shared? And finally, do patients receive a copy? And how would that work in case of situations where clinicians and patients have no smartphones?
Okay, wow, all right. So yes, we do work in some rural parts of Africa, and we do face the problem of unreliable source of electricity or unreliable internet conditions. And of course, there is a need to have some sort of electricity and some internet connection. A zero infrastructure approach is, let's say, not feasible at the moment. But what we have managed to do is that we can work at the most dire circumstances we can. So the technology can handle electricity outage, it can handle extremely slow and unreliable internet connections. And this has been done across dozens of hospitals so far. I believe the second question was on the format for the diagnostic report. Okay, so we have really multiple approaches while we can deliver electronically via WhatsApp messages or text messages or links to our own platform that is accessible for a patient portal and a clinician portal as well. And then, of course, there are some areas when we are still going with a paper approach. So we don't limit our hospitals in ways they can receive their reports. We offer them a variety of solutions, and then they can use whichever makes sense for them in general or at particular day or moment, depending on the situation they're facing. So working in rural Africa, working in low resource settings in general, you just need to have a lot of flexibility and to have many different approaches that can all be equally accessed by the hospitals. And I think we had one last question, right? No, I think that's it, right?
Yes, that's it. You've covered it. You've actually covered it, yes. Thank you, Oz.
Okay.
Thank you so much to our dear panelists for joining us today, and also everyone who's on the webinar. Thank you for your time. Thank you for the passion that keeps you coming back to join us for every webinar that we have. What's our key message today? The challenge is 4.5 billion people still need access to essential health services. The opportunity, digital technologies and AI-driven solutions can help us close that gap and make it a bit easier for patients and people across the world to access more equitable and sustainable healthcare. Thank you for today, and we'll be posting the webinars also on the places that we communicate through, and we really look forward to seeing you next time.